When you've tried 2, 3, or 6 different treatments for depression, failing an SSRI or talk therapy often feels like a personal failure. But this funnel shows the statistical reality. While standard treatments help a majority of people, 20 to 40% of patients will fall into the category of treatment resistance. To move forward, we are going to evaluate 9 advanced interventions, ranging from medical implants to psychedelics, through a strict return on investment lens. Before looking at any of these options, you have to rule out untreated physical bottlenecks. Basic lab work can easily catch issues like low thyroid, anemia, or vitamin deficiencies. Next, you need to verify your diagnosis. A patient presenting with severe unipolar depression might actually be suffering from bipolar disorder or severe ADHD. Skipping these prerequisites means any advanced treatment you try is a misdirected and potentially harmful investment of your time and money. Electroconvulsive therapy, or ECT, carries the highest efficacy rate in psychiatry. The logistical inputs for this procedure are massive. It requires general anesthesia, triggering a controlled seizure, and a dedicated chaperone to supervise you through 6 to 12 clinical sessions. This scorecard weighs that high physical burden against its clinical outcomes. ECT provides 70 to 90% relief and can keep a patient alive during an acute crisis, but it carries a high risk of temporary memory loss. Transcranial magnetic stimulation, or TMS, offers a localized alternative. The primary cost here is your time. It requires daily clinic visits for 4 to 6 weeks, though you remain awake with no anesthesia. Looking at the TMS scorecard, you trade daily schedule flexibility for an intervention that yields a 50 to 60% improvement rate with 0 systemic side effects. ECT provides an aggressive intervention for acute crisis survival, while TMS delivers an excellent return on investment for the medically sensitive patient who can accommodate a demanding schedule. Ketamine operates as a rapid-speed disruptor, capable of halting severe depressive symptoms and suicidal ideation in a matter of hours. To achieve that, you endure a dissociative state in a clinical setting. You also have to navigate steep out-of-pocket costs to access the highly effective off-label IV administration. This scorecard illustrates ketamine's trade-off: rapid speed for crisis stabilization, balanced against high costs and the frequent need for ongoing maintenance sessions to sustain the effect. Psilocybin, the active compound in magic mushrooms, is an experimental treatment capable of reorganizing brain networks. The input requires taking the compound under rigorous medical supervision for a 4 to 6 hour session. As this scorecard shows, psilocybin requires navigating legal barriers and strict psychosis risk screening in exchange for profound, lasting insights after just 1 or 2 sessions. These rapid disruptors buy vulnerable patients immediate perspective and time, but they demand careful risk assessment and financial planning for the long term. Vagus nerve stimulation, or VNS, offers continuous automated regulation of your nervous system. It requires the surgical implantation of a device directly into your chest or neck. This scorecard grades VNS you take on upfront surgical risks, and in return, you secure an intervention requiring 0 daily effort, even if the results take months or years to materialize. We also have to evaluate extreme metabolic and lifestyle interventions, like strictly monitored medical keto diets, intense cold water exposure, or fecal microbiota transplants. The input here is rigorous. You commit to severe daily adherence to environmental extremes or highly experimental physical procedures. This scorecard highlights the dilemma with metabolic interventions. They require massive physical discipline to theoretically stabilize your metabolism, but they currently lack robust, long-term clinical data. Systemic physical approaches build general bodily resilience. Relying on them as primary treatments for severe, treatment-resistant depression is a gamble until the clinical backing catches up. This is a TRD escalation matrix, plotting speed of relief against clinical evidence. Your goal is not to try all 9 treatments, but to match the intervention to your specific crisis level and lifestyle. For a crisis patient who needs immediate intervention to survive, ECT and ketamine sit in the top right, offering fast relief backed by high clinical evidence. If you are sumptuously stuck, able to work but feeling awful, TMS appears in the top left, trading speed for a lack of systemic disruption. For those looking to optimize and willing to accept more risk, psilocybin and metabolic interventions sit lower on the axis, reflecting their experimental status. Accurately diagnosing your risk tolerance and crisis level prevents wasted capital and dangerous delays. When you are exhausted by treatment-resistant depression, you become highly vulnerable to predatory marketing for treatments with zero scientific backing. Crystals, homeopathic dilutions, and essential oils lack the clinical evidence to justify your time or money. You need to focus strictly on interventions that demonstrably alter neuroplasticity or metabolic function. Think of severe depression like deep, icy ruts on a ski slope. Extreme medical treatments act like a massive snowfall, covering old, rigid neural pathways. Whether a magnetic pulse or chemical compound delivers that fresh snow, active therapy is the mandatory tool you need to carve new, healthy tracks. Advanced medical interventions provide your brain with the raw biological capacity to heal, but disciplined psychological skill building is what determines your final destination.